Good afternoon, my fellow classmates. Today I will be talking about nursing preceptorship and giving you a little bit of information that will help you understand your preceptor a little bit more on your senior practicum, which we will be starting next week. Yay! Preceptorship is not an entirely new concept in the nursing profession. It has been an important dimension of nursing since its origins during the time of Florence Nightingale, when nurses were expected to facilitate student nurses in their learning and to guide them in the care of their patients in the practice setting. Today, it has become a highly effective approach to the clinical teaching of nursing students and an integral part of the orientation of the new nurses. So first of all, the preceptor is the practicing nurse, either LPN, RM, BN, and they are selected to work in a clinical area with an undergraduate nursing student on a one-to-one basis to enhance the preparation for clinical practice in professional nursing. The preceptor will assist the student to understand the roles and functions of nursing, for example, decision-making, problem-solving, how to communicate with other health professionals, organizational skills, and to help increase competencies and technical skills. Preceptors facilitate the orientation, growth, and development of nurses who will one day work side by side with them and become their colleagues. A few roles of a preceptor include that they will provide an orientation for the student. So they will help you locate equipment, physical layout of the unit, process to acquire supplies, locations of the client's record, charting process, staff rotation, and explanation of the nursing unit routines. They will also provide an orientation to facilities, emergency, and special code procedures. They will maintain a current knowledge base that serves as a resource nurse role. So they will explain policies and procedures to students, highlighting interpretation and key points, and they will coach you in solving clinical problems. Preceptors will model professional nursing practice. So they will demonstrate application of clinical procedures and coach you in the execution of complex skills. And they will assist you by setting priorities, which may include delegation of tasks. They provide clinical supervision. They will construct daily assignments to you, and they will provide learning activities appropriate to your abilities. And they will assist you in adapting to the new role in professional practice. They may schedule meetings to review your progress and exchange constructive feedback. It is important for the preceptor to provide clear, objective feedback in a timely manner. When the student is not meeting course expectations in the clinical setting, they will provide assistance on how to make changes in order to meet the course objectives. There are some things about your preceptor that you might have not known before. Precepting can be a volunteered experience, so most of the time they may not have a choice taking in a student, whether they are busy or not, and typically they don't receive extra pay. They don't always know what you're capable of. So in the beginning, it is very important to let your preceptor know what skills you were taught. And if your preceptor calls in sick and you get a new preceptor for the day, let them know as well. They don't always know when you don't understand, or even know when you feel uncomfortable. So if something confuses you, or if you're not too sure about a particular procedure or particular skill step, let them know and always ask. They hover with a purpose, not to annoy you, but to make sure that you are being safe, sterile, and doing everything right, so that in the end, they can let you know if you have anything to improve on. They step back when you're ready to fly solo. It doesn't necessarily mean that they don't want to be with you or they're just being lazy that day. It's actually because they think that you're ready to be by yourself and develop more independency. They need your feedback. Preceptors are continually learning and improving on themselves as well. It is important for you as a student to let them know how they are doing as preceptors so that they can improve or change whatever they can for the next student they are with. There can be some downsides to precepting, so there are a few questions to ask yourself before requesting for a new preceptor. Are you still learning from your preceptor despite your differences? Not all preceptors will be your best friend. Everyone has their own personalities, and you may bump heads with them or not get along too well. But if you're still learning from them, keep going, because there's always something to learn from someone who's different from yourself. Otherwise, if you feel like you're not learning very much as expected, you can always talk to your educator to seek better options. Are your questions adequately being answered? It becomes a huge problem when you are trying to find answers when your preceptor is not willing to answer any of your questions, constantly telling you to find it on your own and ending it there. That's a good reason for requesting to change your preceptor. Are you always alone during procedure? If your preceptor is always at the nursing station, sitting at the desk and not participating in any procedures or skills with you, that is a big problem as well, especially in the beginning of your rotation when you know nothing about the unit and need help with skills you've never done before. And last key point is to make sure that you are ready to talk professionally to your instructor about your preceptor. So making sure you're saying things to your preceptor like, this person is not helping me with new procedures, it's making me feel uncomfortable because I feel like I'm not providing the safest care to my patient, instead of saying things like, we just don't get along, I don't like their scrubs, the end. So those were a few things that you can ask yourself before requesting a new preceptor. Just make sure that you are giving them a good, fair chance as well. Lastly, there are a few things that us students are expected to do while we're on practicum with our preceptor. We must always come prepared for work, on time, and appropriately dressed. Let your preceptor know what clinical areas you've already had experience in, and let them know what you hope to learn during this senior practicum. Show them your learning plan so that they have an idea of your goals on clinical. The preceptor's responsibilities with our learning plans are to review and recommend various strategies that will assist the student in being successful, provide ongoing feedback to the student on his or her progress, and to keep the nursing instructor informed as to whether the student is meeting the course objectives. Ask as many questions as you need to, but be smart about it. You don't want to ask questions like, why do we always have to chart? Or, this patient's respiration is at 10. Do I still give him morphine? You also want to demonstrate self-direction by actively seeking new learning experiences and being prepared to accomplish the learning objectives for the experience. And lastly, but not the least, you want to establish a trusting relationship with your preceptor. This will help to provide a foundation upon which learning experiences will develop. Thank you for watching. I hope you guys learned a little bit more about nursing preceptorship, and good luck to everyone going out to senior practicum. Congratulations in advance to everyone that is graduating this year.